breaking news today.
Please subscribe and then check notification box to get all breaking news alert.
Muslim healthcare worker goes on sex assault rampage in Canada, gets no jail time. Canadian Prime Minister Justin Trudeau has welcomed socialist policies into his country, and has embraced multiculturalism. He seems to think that makes his country progressively modern. Others would disagree. As Trudeau makes excuses for Muslim culture, and criticizing President Trump's stand against it, his citizens are paying the price. Take what happened to a number of defenseless senior citizens who were subjected to one Muslim's sexual depravity. Even worse, the man got off scot-free. In Ontario, Canada, a family discovered their 90-year-old mother and grandmother had been sexually assaulted the week of her birthday by a hospital worker who committed the same sort of crimes on countless others. The incident happened in September 2015 and the accused worker, 53-year-old Shojazadeh, who is also known under the name Shojaden Mohammadzadeh, was caught by a nurse who walked in on the assault. To make matters worse, the hospital attempted to cover it up, firing the worker and not calling the police. The incident is not only an indictment of the lax attitude towards Muslim culture and Canada's politically correct mindset, it also reveals much about the socialized medicine system in Canada that Democrats in America love to point to as beneficial for patients. After being fired, Zadeh went to work at a nursing home, where he sexually assaulted at least 2 residents. He is suspected of assaulting many more there. Even though he faced more than a dozen charges, he took a plea deal and received 3 years probation. He still lives with his wife and children in the area. One of the nurses walked in and opened the drape around the bed and saw him being a hospital PSW who is responsible for bathing and changing patients, doing ungodly things to my grandmother, Ran Sheridan, the woman's grandson, said, recalling what officials said. They said it was horrifying and horrible. We won't tell you more. I was sitting there and I said, what did police do? And they said, we didn't call the police, we fired him, Eva Sheridan, Sonia's daughter, said. York Regional Police told Global News the hospital did not report the alleged assault to officers and that the complaint came from the family of another victim. Rand said hospital officials told his mother the matter was kept within closed doors to not jeopardize the hospital's reputation. We've been on this for 2 years fighting and the legal system is not doing much of anything. The legal system clearly is not, he said. September 14, 2015. Nearly 2 years ago. On the week of her 90th birthday, my grandmother, Sonia Sheridan, tied down, was beaten and sexually assaulted by a hospital-employed PSW, Shojaden Mohammadzadeh, at Mackenzie Health Hospital in Richmond Hill, Ontario, Canada. For 2 years, I have been silenced. But silence is betrayal and today, I break that silence. The Canadian health system has kept this hushed, the Canadian legal system has swept this under the rug. Publications are afraid to air this out, and victims' families are coerced into silence. Here, today, I beg of you to share this story far and wide, make it spread like wildfire. Share to your page, others' pages, public pages. Make this story viral so to prevent others from being victimized just the same. Make this story viral so to open this Pandora's box of bureaucratic corruption, however high its chain of command may be, to disincentivize the concealment and encouragement of criminal activity. Between March 2015 and October 2015, Shojaden Mohammadzadeh, then 51, allegedly assaulted and sexually assaulted at least 4 elderly patients, aged 88 to 91, at Mackenzie Health. The hospital's upper management, from its CEO to Executive VP, Operations Director, Patient Care Manager, Manager of Employee Relations, and Human Resources Director, had been promptly made aware of the assaults, and deliberately elected to conceal all offenses for the majority of the 7-month duration, as later divulged to my mother by hospital management as well as by police. On September 14, 2015, a hospital nurse went in to check on my grandmother, then severely ill with pneumonia, virtually comatose, only kept alive by tubes. To the nurse's repulsion, she saw Zadeh, a PSW responsible for cleaning and bathing patients, aggressively sexually assaulting my unconscious grandmother. Her hands were strapped to the bed, her lower lip and arms battered and painted every shade from blue to red. The nurse immediately reported this to hospital management, who instructed her to keep silent. By this point, Zadeh had already spent 6 months sexually assaulting hospital patients. Management knew, and explicitly directed its staff to not disclose a thing to police or victims' families, so to protect the hospital's reputation. Zadeh worked for Mackenzie Health Hospital for 17 months. The aforementioned offenses are the ones we know of. Nearly 2 years later, many of the victims deteriorated and shortly after passed. Zadeh currently resides with his family in Newmarket, Ontario, Canada. Following his ultimate dismissal from the hospital on October 19, 2015, following a flaccid 2 days in jail, Zadeh was employed by community and home assistance to seniors and proceeded to sexually assault additional women at Hadley Grange, an elderly assisted living facility in Aurora, Ontario. Zadeh also sexually assaulted an elderly man at the victim's own home while serving as a PSW for We Care Home Health Services. In January of 2016, already weaker and ill with another devastating bout of pneumonia, my grandmother was rushed by her nursing home back to the neighboring Mackenzie Health. Following weeks on life support, of treatment and recovery, she was returned to the comforts of her nursing home, thin as a rail, psychologically devastated, again with arms painted all shades of hell. On May 31, 2017, Zadeh's charges were discounted on a sweetheart deal from 15, including 13 of sexual assault, to 1. His intended trial of 5 weeks. Closed. All victim and family testimonies, dismissed without notice. All sexual assault charges expunged as though never existed. The reasoning? Insufficient evidence. But wait, do testimonies not equate to evidence? The court ordered the investigation to immediately close, and knowingly let a serial criminal on the loose. On August 1, 2017, my mother, fiancé and I met with the Crown Attorney at the Ontario Superior Court of Justice. We sought clarification for the criminal verdict. The Crown, satanically cold, conceited, calculated, venomously acknowledged said crimes with ease and an unapologetic smirk. He admitted to the number of offenses and sexual nature of the attacks, shamelessly recognized that Zadeh is a danger to the public presently and in the future, repeatedly stressed we must accept this as how the system works, and that the case is incontestably closed. Nearly 2 years later, my family has endured an unspeakable toll. The other families too. I, scarred for life. My mother? A shadow of her former self. My grandmother? Dead. Abuse exists because of secrecy. The abuser didn't protect you, so why should you protect the abuser? One's silence is another's suffering. To be silent is to be an accomplice. It is my objective to use this platform, among others, to break that silence. If you are a major print or online publication, news outlet, television talk show, media personality, advocacy group, elderly or women's advocacy group, integrity campaigner, or a spokesperson of sorts, please do not hesitate to reach out. This synopsis message is where a public revolution for change commences. Do you want to be a part of that change? Thank you for watching this video. What do you think about this? Share this on Facebook and Twitter along with your comments.